Hi everyone, my name is Jessica Collinsworth and this is my patient case presentation on lateral epicondylitis, or tennis elbow. Before I begin the case presentation, I'd like to start with a quick overview of lateral epicondylitis. Lateral epicondylitis is the medical term for tennis elbow. Tennis elbow is caused by overuse and can result in pain and recurrent and long-standing inflammation. It is most associated with the swinging motion made while playing tennis, but the injury can be caused with any activity that causes similar motions. Good morning. I'd like to present my findings for our first patient. She is a 39-year-old female with a chief complaint of right elbow pain. She presents to the clinic with right lateral elbow pain for 2 weeks. She first noticed the pain after spending all day in the yard weed whacking. She describes her pain as 5 out of 10 aching pain. It's worsened with activity, and it's better with ibuprofen. She's been taking 2 over-the-counter ibuprofens. Her past medical history includes chickenpox as a child, a history of substance abuse, being overweight, and tobacco use. At home, she's taking ibuprofen 400 milligrams every 6 hours as needed. She also takes a multivitamin with minerals every day. The only surgery she's had is her gallbladder removed. She's never been hospitalized. She's up to date with her Tdap. She got it in 2016. She works at a fast food restaurant as a manager. She admits to smoking 1 pack of cigarettes per day for the past 20 years. She also has a history of IV heroin use on and off for about 10 years, and also a history of alcohol abuse. She says she's been sober from drugs and alcohol for over 6 years. She continues to go to NA and AA meetings. She denies any recent sexual activity. Her last period was on 5/29. She describes her periods as normal. She's been pregnant twice, but never had a live birth. She's had 2 miscarriages. Her Pap and Mammo are up to date, and she's never had any abnormal results. She denies any history of depression, anxiety, or thoughts of suicide, and she says she's never had any problems with mental illness or hospitalizations. She has a family history of diabetes in her mom's mom. Her mom has hypertension. She also has rheumatoid arthritis and fibromyalgia. Her sister has lupus and fibromyalgia. She denies any personal history of fibromyalgia or lupus. Within the review of systems, the pertinent negatives were that she has not had any fevers, she has had no numbness or tingling, no tremors or involuntary movements. She denies any trauma to the elbow. The pertinent positive was that she is complaining of right lateral elbow pain that's worsened with activity. Everything within the exam was normal, except for the exam of her right elbow. When I palpated the lateral epicondyle, it was very tender. She also complained of pain with the resisted wrist extension when the elbow was fully extended. The pain was also elicited with passive wrist flexion while the elbow was fully extended. Otherwise, she had full range of motion in her joints. Her right wrist was about 4 out of 5 strength, and the rest of her joints were 5 out of 5, but she denied any weakness. The possible differential diagnosis for this lateral elbow pain would be epicondylitis, loose bodies within the joint, a defect in the bones, arthritis, valgus extension overload, radial tunnel syndrome, inflammatory arthritis, synovial plica, or problems with her nerves in her neck. Considering the family history, for this patient, I think that our differential diagnosis should include lateral epicondylitis, rheumatoid arthritis, and osteoarthritis. I think our plan for her should be to tell her to take ibuprofen 600 to 800 milligrams by mouth 3 times a day for 3 to 4 days, and then as needed after. She should also use an elbow brace, use ice and heat as needed. We could also give her a referral for physical therapy. If she doesn't have any improvement in 4 to 6 weeks, we can consider a referral to ortho or more tests to rule out osteoarthritis and rheumatoid arthritis, such as ANA levels or an X-ray.